I think we'll get started just so that we don't overrun and disturb the next talk on the main stage. Good afternoon, everyone. It's lovely to see you all here. I'm so delighted to be in conversation this afternoon with the wonderful Dr. Anjali Mahto. For anyone that doesn't know Anjali, I'm sure you do, but a brief introduction. She's a wonderful consultant dermatologist and founder of the Self in London, a really beautiful and zen clinic on Harley Street. Anjali is the font of knowledge when it comes to acne and acne scarring, so I'm so delighted.
Thank you for having me. I'm looking forward to all of the questions that we have as well.
And I'm going to leave a little bit of time if people want to ask some questions. It would be great for Anjali to answer them.
Yeah, absolutely.
So I guess we'll start at the very beginning. So you are such, like I say, a voice when it comes to acne and acne scarring. And I think the skin is such an important part of wellness. It's what everyone sees, so it doesn't only, it affects the way that we feel more than anything else. So I know you've also been on a journey yourself with your skin as well. So I'd love to hear a little bit about that and how that affects your approaching clinic.
Yeah. So I'm now 44. I developed acne for the first time when I was about 12. It was actually quite a difficult time in my life when this all happened as well. So I had just moved countries, my father had died, and about 2-3 weeks later, I developed very, very severe cystic acne. And I was relatively young, I was 11, 12 years old at the time, and it was a really difficult couple of years. I mean, I think it's hard being a teenager anyway, but I think when you've had all of those life changes going on, you can see the spots on your skin. A lot of people that suffer with acne will say this, but you feel dirty, you feel ugly, you feel disgusting, and people judge you. And there's a great deal of stigma that's associated with skin disease that we don't really talk about. There is no doubt that it had an impact certainly on me and my self-esteem and my confidence. And it was only when the acne got treated that I felt like a completely different person. I think unless you've suffered with your skin, you don't really, I think people don't understand what it's like. I think that's probably the best way to explain it. And I think people treat you differently, and I think I have first-hand experience of that as well. The way that people treated me when I had spots versus the way that I was treated when my skin got better. And suddenly people thought I was cleaner, or I was healthier, or they wanted to be my friend. And all of those experiences, when I ended up going to medical school, we all had to rotate through specialties. And for me, skin just made sense. I understood the skin patient and the dermatology patient because I knew what it was like to be at the other side. So it was the personal experience aspect of it. And I think for me, all of those kind of experiences that I had growing up, I just didn't want somebody else to have that. I didn't want somebody else to have to feel that way. And I also wanted for people to recognize that, your skin has got so much of an impact on how you feel. So when it came to setting the clinic up, it isn't just about getting the skin to look better, it's about getting you to feel better about it as well. So I think those are my motivations, and that's the reason why. And my acne has grumbled on and on since then. It comes and goes. I can treat it, I can manage it, but I think what's happened over time is I've got to a point of my self-esteem, my happiness not linked to my skin. And it is possible for me, if I can do that, everybody else can do that as well. And I think that's the goal.
I think that just goes to show you how revolutionary your work is with people that are suffering at that time. I can speak for your practice. You were the first person I saw when I had acne myself, and you can see that you're training, you've had the experience yourself, you can see that. What are the first steps that you take if someone comes to you and complains about a breakout?
So if somebody comes in with acne, usually by the time they get to clinic, they've done an awful lot of research. They've also tried an awful lot of products already. So lots of skincare, lots of face washes, lots of moisturizers. So usually, if someone comes to see me or a consultant dermatologist, the process that would take place is we would want to find out a little bit more about you and your personal story. So how long have you had the spots? Are the spots just affecting your face? Is it your back, your chest as well? Is it multi-site in nature? How is it affecting your self-esteem? So everyone that comes to me gets asked the question, on a scale of 1 to 10, 10 being the absolute happiest you could be with your skin, when you woke up this morning and you looked in the mirror, how would you rate your skin? And that number, and what number someone gives me, tells me very much a lot about how they feel about themselves and the mismatch there might be between, say, what I can see and how they feel. And we need to address that. I do also, particularly women, ask about hormonal health, so about periods, menstrual regularity, because that can be quite relevant. Sometimes hair issues may also be relevant because there is a condition called PCOS, polycystic ovaries, that may also impact acne formation as well. So there's lots of baseline info, lots of information about what you've tried already, what your medical history is like, what meds are you on, what supplements you take, what is your diet like, is it inclusive, is there anything you cut out? So it really is wanting a full story, knowing everything about you before I even look at the skin. And then when we're looking at the skin, the idea is to see how much acne is there, what type of acne spots are there? Are there lots of blackheads? Is the skin oily? Are there large, deep cystic spots, the ones that don't really come to a head? And is there scarring? Because if there is scarring, you need to treat the acne aggressively to get that process switched off.
That was going to be my next question. So I'd like to move swiftly on scarring because I think that's a really important part of the acne journey. How many people suffer from scarring? Is this something that you see often, or do most people have active acne and it just goes away?
Acne scarring is actually incredibly common. So if you look at clinical literature, it's anything between 45 to 95%. One of the problems that we have, just purely due to health economics in this country, is that acne is treated at quite a late stage, simply because access to dermatologists is quite difficult. And the longer that you leave acne untreated, the more likely it is that scarring is going to develop. When you get scarring, there are different types of scarring that can occur. So as a derm, we normally think about tone and texture. That's how I usually divide it in clinic. Tone for me is colour. So if you have an acne spot, has it left a brown mark on the skin, which is what you see more commonly in Black and Asian skin, so we call that post-inflammatory hyperpigmentation, or are there red marks on the skin? And you see that more commonly in people who've got fair skin types, post-inflammatory erythema. So that's the colour, brown marks or red marks, and there are different treatments for those. And then we talk about texture. So is the scarring indented, or is the scarring raised? And then what can we do about that as well? But acne scarring is also thought to cause as many problems with self-esteem and body image as the acne itself. It just goes very much under the radar.
Before we discuss some of the treatments that you have available to deal with scarring, is there anything that predisposes us to that scarring?
So again, looking at data, the longer you leave acne untreated, the severity of your acne. So if you have got a lot of cystic acne rather than blackheads, it's much more likely to scar. Scarring is more common in the male gender versus females. It's also more common if there's a family history as well. So there's a lot of factors to take into account, but usually if you are going to see a specialist for your acne, they should really be looking for your scarring as well and a degree of that that's present.
And I know you have a wealth of modalities to deal with scarring, but I'd like to focus specifically on lasers. At what point do you decide to intervene with a laser to deal with the scarring locations?
In general terms, it's really important to get the acne itself switched off before you do the scar treatments. And the reason for that is if you're still getting active breakouts, there is no point wasting loads of time and money on a laser treatment and then a week later having another breakout and getting more scars. So I think it is important that the order of events is quite important. But once the acne is switched off, and that may be with oral medications, if it's mild to moderate, it may also be with different types of laser treatments, that's the point when you would want to initiate scar therapies. So there are lots of different modalities, as you mentioned, that we can use for that.
I'd love you to explain a little further about the lasers that you use in your clinic, because there are so many, isn't there? It's become so overwhelming for the consumer. So if you could just break it down slightly, that would be fantastic.
Absolutely. So there are lots of different lasers. If you go to the internet and read lasers, lots of different terms will come up. So if we look at acne scarring in particular, there are two gold standard acne scarring lasers, the erbium YAG laser and the carbon dioxide laser. Now, there are differences and pros and cons between those lasers, but let's talk about how they work first. Essentially, what lasers will do is they will create a controlled injury to the skin. And that controlled injury triggers a wound healing response in the skin. And that wound healing response will produce more collagen, that main protein in our skin that gives us support and structure, and will kind of plump out the areas that have become indented. If you have scar treatments carried out with laser, you have to be patient. You will not see improvements in a week or probably even in a month. The reason for that is there are about 30 different types of collagen in our body. Type 1 and type 3 collagen are the main collagen types in our skin. When you have a laser treatment carried out, be that with an erbium YAG or the carbon dioxide, what initially happens within the first 7 days of that wound healing process is your body starts putting down type 3 collagen. Type 3 collagen is a little bit weak, it's a little bit flimsy, and it takes cells in your dermis, the deeper layer of your skin, where the scarring occurs, somewhere between 8 to 12 weeks to convert that kind of flimsy type 3 into the good scaffolding type 1, the stuff that you want. So number one, you're in it for the long game. Number two, you often do need multiple treatments as well. Now, my personal preference is to use the erbium YAG laser, and the reason for that is I find it is safer across all skin types. So you can use it in darker skins much more safely. That's important because London is a diverse, multicultural city, and it's really important that the clinic we have serves the population and the needs that we need. The one benefit I would also say of the erbium YAG, in addition to the fact that it's safer across all skin types, is it does cause a lot less pigmentation and redness post-treatment as well. So when you carry out a laser treatment, there is a risk of darkening the skin in darker skin types, or there's a risk of reddening the skin in fair skin types, and that could last up to something between 8 to 12 weeks potentially. You can reduce that time by using an erbium YAG. Now, people that frequently use carbon dioxide, and I have used a CO2 in the past as well, will say, okay, the benefit of a CO2 over an erbium YAG is a CO2 because more tightening of the skin. So if you were also looking to cause skin tightening, there might be benefit. But the beauty of the laser that we have in the clinic, the profractional, is you can actually simulate settings for it to emulate a CO2, so you can dial up heat. So if you did want to do skin tightening as well, so let's just say I've got somebody who is 50 to 60 years old, they want the skin tightening effects, but they've got acne scarring, which by the way does start to look worse as we get older because we start to lose collagen. You can dial the heat in. But if you've got somebody who's a bit younger, but you don't actually need that skin tightening effect, and I've got a 17, 18-year-old with scarring, I don't need to do that. And I know that I can safely and aggressively control the depth of that laser, which is also important, because if you think about your skin, scars occur in the dermis, the deeper layer of the skin. So you've got the epidermis on top, dermis below, and scars can be of different depths in the dermis. So when you're doing the treatment, you need to know roughly what depth you need to be in. So for example, with the laser that I have, I can set the energy settings and the depth of that to 100 microns, which is about as thick as a piece of paper. That's about the thickness of your epidermis, the top layer of your skin. But if you've got scarring, I'm not going to treat with 100 microns because the scarring is going to be deeper than that. So the person that's treating you also has to have a good handle on the anatomy and the physiology of the skin, where the depth of that scar is, to make sure that you've gone deep enough to hit the problem where you're going to boost that collagen.
I think that's really important, isn't it? Sometimes it's more important who is in control of the lasers as opposed to the lasers themselves. They're so powerful. Is there anything that we can do alongside the laser to optimise the results?
Yeah, absolutely. So I think aftercare and pre-care is actually just as important. So the maintenance of a good skincare routine. So if I was going to do laser treatments on somebody, I would want to make sure they have nailed their skincare routine before I book them in for a session. And by that, what do I mean? Well, I want to make sure the acne is under control. I want to make sure they are using a regular sunscreen, high factor 50, every day, even at this time of year. Because if you're not in a habit of doing that, you're not going to be in a habit of doing it after I've carried that laser treatment out. And I want a good result as much as you do. So we have to make sure that no one's going to do anything that's going to compromise those results. It's also important not to be using too many active ingredients a couple of days before that laser treatment is carried out as well. So it is a good idea if you're using things like exfoliating acids, your alpha, your beta hydroxy acids, vitamin A's, you discontinue those for about 48 hours as well. After the laser treatment, it's also important that you are moisturising your skin using a barrier recovery cream very, very frequently, and moisturising, if you're at home for the next couple of days, on the hour, every hour, the high factor sunscreen when you go out, and then again, don't restart any actives till the skin has properly healed. Healing time will depend on the laser type that has been used, the depth of the setting that I have used, and how much of the face or the back that I have treated. But after about a week or so, you should be able to go back then to your regular skincare routine, which should involve a degree of acne maintenance, because obviously one of the reasons you're doing the treatment is for scarring. You want to make sure you don't trigger acne again because of the heavy moisturisers that you're using in that recovery.
That's really important. I was going to ask you actually about the downtime. So you explained, what can somebody walk out of clinic after this? The word laser, I think, sounds so scary to a lot of us, putting a laser to the skin, but sometimes the downtime isn't so debilitating, is it?
No, that's right. And I think ultimately this comes down to how quickly do you want results, how severe or extensive is the scarring, and also I think in addition to that, it's really, what kind of end results are you looking for as well. A good outcome for acne scarring is considered to be about 50% improvement in the scars. I would be lying if I said to somebody, I can fix your scars and I can make them go away and they will never come back again and the skin will look the way that it did before that scar process took place. You can't do that. But you can get something between a 30 to an 80% improvement. You can be at the higher end of that by making sure you're doing as you're told and by making sure that we have switched the acne itself off as well. But there are gentler treatments that you can do with laser. So laser facials, for example, where you go much, much more superficially. So I kind of talked about depths and microns. So if you were just looking for a little bit of a glow, you're not too worried about your scarring, or the scarring is quite superficial, you can actually do relatively gentle laser facials. So you could do sort of 100 micron treatments, 150 micron treatments. You'd be a little bit red for a day, 2 days, 3 days, but you'd very easily be able to cover that with makeup by day 3. If you want to go all guns blazing and you're like, give me the most extensive treatment that I can, my scarring is quite deep, with something like the profractional, it's actually quite predictable in the sense that recovery normally is about 5 days. Now, there are stronger lasers again. So the profractional laser is an erbium YAG laser, but it is a fractional ablative laser. So what that means is rather than treating the whole of the skin, it treats fractions or columns of the skin. And you leave normal bits of skin in between, and your skin recovers much more quickly because you've got all the growth factors and the healing factors from the normal skin in between. But you can also use an erbium YAG or a carbon dioxide laser in a fully ablative manner. So that basically means you just completely vaporize or get rid of the top layers of skin. If you do a treatment like that, your recovery will be longer, and you would be looking at something up to 2 weeks, potentially. So in terms of choosing right laser, right person for that treatment and recovery time, it's really a very, very personalized discussion with the person and what it is they want.
And finally, before I open up the floor to a few questions, if anybody does have any, these lasers don't just treat acne scarring, do they? They treat a wealth of other concerns too. And I think that's really important because some people here may not have the concern about acne. Can you just briefly touch on some of those other concerns that these lasers can address?
Yeah, absolutely. So if we're talking specifically about kind of acne scar lasers in general, they work by boosting collagen. Now, we all know that we lose collagen as we get older, and the figure that's commonly quoted, you've probably already heard it today, but it's about 1% a year from your mid-20s onwards. After you go through the menopause in the first 5 years, you lose about 30% of your dermal collagen. So, if you think about it, if you have a laser treatment that's going to plump collagen up in scarring, it's going to have anti-aging benefits as well. Because what it's doing is it's acting on collagen in the skin. So a lot of the lasers that we use for acne scarring are exactly the same lasers that we use for resurfacing the skin for anti-aging purposes. So fine lines, wrinkles, if the skin is starting to become a little bit like less radiant, all of those things will also benefit from having a laser treatment carried out, because what you're doing is you're boosting collagen in the skin and you're banking that collagen.
Exactly, back to the topic, skin renewal. Thank you so much, Anjali. It was fascinating as always. Does anybody have any questions? I'm sure Anjali will be hanging around. If not, I'm trying to make my way through. So no worries if that's okay.
You're welcome.
I'll start at the front.
Thanks, and it was a lovely summary of a very complex topic. I'm curious to know, do you, especially with your dark skin type patients, do you prepare them with kind of to prevent hyperpigmentation, kind of rebound hyperpigmentation from the laser, from the heat?
Yeah, absolutely I do. That's a good question. If it was a fully ablative laser, no, there's no point because you're going to be ablating the whole tissue. It's pointless pre-cracking the skin. But in skin of colour, Fitzpatrick type 5 type 6, so darker skin types, black Asian skin, I will, for 2 to 4 weeks prior to the treatment, if I'm doing a fractional ablative erbium YAG, I will use a 100 quinone containing product. They will then restart that 7 days post-laser and use it for 4 weeks before they then come in for their next session.
Any other questions?
Hi, you briefly touched on sort of hormonal acne
Yeah.
in women. When it comes to treating, let's say, hormonal acne and people coming in perhaps wanting like divisive treatments, because that can be quite cyclical rather than necessarily like always on your face. How do you advise people who might really struggle and say, actually, I get down to 2 in confidence, my skin when it happens, but it's not all the time?
Yeah, I think it's really important. I know we use the word hormonal acne a lot, and we use it to refer to female adults who suffer in that U-zone area, and it flares up with menstrual cycles. The truth, though, is all acne to some degree is hormonal, because it's a multifactorial process. It's partly to do with the enlarged oil glands, partly to do with the effects of the hormones, the androgens in the skin, partly to do with the natural microbiome of the skin, and partly because the skin cells themselves don't shed in a way that they should. So when I see somebody with hormonal acne, I take that on board. But when it comes to acne management, I have to deal with that person's worst day, not their best day. I don't want somebody to be living with a 2 out of 10, even if that's for 5 days a month. Like, nobody should have to do that for a very treatable condition in that manner. So I think really my approach to that would still be, well, look, these are your options. Let's look at how severe it is. Photos in clinic are also super helpful then as well. When people are like, my skin's great today, typical, I've come to see you, but here are my photographs on my smartphone of what it looks like. So my approach actually wouldn't be that different, because ultimately what I want to be able to do is get people to a place where they can give their skin a good solid 8 or 9 out of 10 every day. I don't look for 10s, that's unrealistic, it's impossible. But if someone's an 8 or a 9, I'm really happy with that.
Any other questions?
Yes, hello, Anjali. You treated me 2 years ago with my rosacea, and it's so much better than it was.
I'm so glad to hear that.
But I wondered if you had a recommendation for a serum for somebody who has rosacea.
What are you looking for a serum for?
Well, I don't use a serum at all after your recommendation, but somebody in one of the earlier talks said it was really important to be using a serum every day.
Okay, so here's my take on this, okay? If you have rosacea-prone skin, so just talking in general terms, you have to be really careful with the products that you apply to your skin. I bet I said that to you in clinic as well. I probably took all your products out and said, don't use this, don't use that. But it is important, because one of the issues with rosacea is your skin barrier is disrupted. And if you put loads and loads of products onto your skin, you are much more likely to cause irritation, redness, flaking, flushing, all of the issues that we want to try and avoid with rosacea. So when it comes to serums, one has to think, why would you use them? So you might want to use a serum because your skin needs more moisturizing or hydration. Would I be happy with somebody with rosacea using hyaluronic acid serum underneath their moisturizer? I probably would, actually, because hyaluronic acid is not an exfoliating acid. It's not going to strip the top layers of your skin, so I've got no problems with that. If, however, you said to me, oh, I want to use a retinol serum, and I want to use something that's got a bit of salicylic in it, and it's got a bit of glycolic in it, I'd probably be saying to you, no, I really don't want you to do that. And if you are really that keen from an anti-aging perspective, because that's usually the conversation that then happens, everyone's using vitamin A or everyone's using all of these other ingredients, and I'm not, I'm worried about anti-aging as well. Probably my answer there to you would be, well, actually, there are other methods that you don't have to disrupt the barrier function of the skin, where you'll get a better result, light-based treatments, things like broadband light or IPL, that you will probably find will be far superior than the skincare that you will use.
Any further questions? No, if you just want to be connected with Anjali to hear more about the lasers, please do tick Anjali's name on your referral card. Thank you very much for joining us.